So I elected to come back after being in practice for about 10 years. I elected to come back to the university. I was asked to come back and join the faculty so I could teach, but also really for me, it was about making a bigger impact on the next generation of our profession. So each year I get to impact the 84 new students we have. And these are the folks that will join our profession as veterinarians after they complete their degree. And so as a teacher, as a professor, I get to share my knowledge and energize them to learn. And as a dean, I get to shape the kind of the future and the roadmap for the college. So I see it as a great combination to do that. So veterinary medicine, I've always had a great appreciation for animals, and I think that's key for veterinarians. For me, it was a love of science, a love of math too, but a love of the health sciences and really a great appreciation for animals. So whether it's dogs and cats, I had the benefit of having family with dairy cattle and things, and so I was able to grow up with that as well. And seeing all that together really made me look toward veterinary medicine versus human medicine, because there was a point in my life when I thought about human medicine, but I really found greater satisfaction working with animals and combining my passion for health sciences. So as a veterinarian, you have to obtain your Doctor of Veterinary Medicine degree. So that's a degree after undergrad. So most veterinarians go to school for a minimum of 8 years, 4 years of undergrad, and then 4 years of veterinary school. And at the end of that is when you earn your Doctor of Veterinary Medicine degree. And at that point, you can go out and practice in any area of veterinary medicine. If you want to continue on and specialize, as some do, then it's an additional year of internship and usually additional 3 years of a specialty residency. And at that point, then you would be considered a cardiologist, an internist, a surgeon. You're what's called credentialed specialist at that point. In two ways. First, as a veterinarian, whether you're in private practice, say a family practice that everyone takes their animals to, or a farm animal veterinarian that comes to someone's farm, the day-to-day there is running their practice, working with their staff to see clients and their patients, or going out to farms and seeing animals that way. But it's really doing preventative care as well as doing sickness or ill patient care where you're trying to fix a problem. And that could include medicine, it could include surgery, it just depends on what's going on with the animal. In my role at the university, it's a little different. I wear a couple different hats. So as I practice emergency critical care in the Purdue Veterinary Teaching Hospital, I see everything from a dog that has a skin irritation to a traumatic hit by a car, or a patient that has really advanced disease and needs life intervening care. And that can be 24/7, depends on when I'm on duty that way. So that's how I practice veterinary medicine. As a dean in the college, my day-to-day role is to oversee admissions, recruitment, the day-to-day life of students, and career transition for our students. So here in the College of Veterinary Medicine, I'm considered jokingly by some as one of the principals. I'm here to make sure that everyone does what they need to do and does it appropriately, and that what we're doing as a college is making sure our students get the education they need and so they can graduate. I think with my veterinarian hat on, it's really working with patients, helping them get better, or at times even helping to end their suffering, which helps their family in the end. And veterinary medicine has a lot of ups and downs in it, but it really allows us to use all the new advances in medicine that you think about in humans as well, and we use those in animals. We can do some really great things to make animals feel better, but also heal and do well. My job as a college professor and dean is to teach, and I really like to see, my favorite part of it is when I see a young student in the program, when the light bulb comes on, when they see an idea, they understand it, and it comes through, and the light bulb comes on, they're like, I knew, I got it, and I'm ready to move forward. That's what really gets me going, when we can make that kind of impact on young people. I think really as a veterinarian in practice, I'm always concerned about the idea of the economic limitations people have to be able to treat their animals. Because in veterinary medicine, for mostly expenses are out of pocket. There is insurance in veterinary medicine, but not everybody uses it. So most expenses are out of pocket. And that does limit what people can do at times. And my role at the university, probably my least favorite role is when I have to deal with issues that come from anywhere from the academic side to some of the personal side things. I'm dealing with students, some of the battles they have, trying to help them get over those so that we can try to get them back to the road of success. But sometimes those can be pretty challenging, and that makes for a long, difficult day. So one of the awesome things about veterinary medicine, the doctor of veterinary medicine degree, is that you can do so many things. It can be used in many, many different ways. So most of us know a veterinarian that works in a practice that you see your dog or cat in, or bird, or some type of exotic animal, or that comes to a farm, comes to a stable. So that's those practicing private practice veterinarians that people really think about. But the best thing about our degree is you can do so much more. We're really the one trained comparative biological scientists out there. So that's why there's veterinarians that work at the CDC, they work at USDA, they work in many areas right now, especially with COVID. They work on the front lines of COVID, trying to look at and discover treatments and part of the vaccine protocols. Veterinarians play a huge role in the FDA. And so there's a lot of opportunities. You can work in the government. And there's actual veterinarians that have been astronauts. We've had veterinary astronauts as well. So the most exciting thing about the degree is it allows you to do many things. It opens a lot of doors, and certainly whether it's in a practice setting to somewhere where you're serving the community or serving the research field, you can really find your niche, and it's an exciting time. In the veterinary side of things at a university, there are 30 veterinary schools in the United States. And so each of those schools, for the most part, have a veterinary hospital attached to them. So we both teach and we practice in the hospital. And in doing so, that allows us to generate the next generation of veterinarians. We graduate about 4,000 veterinarians a year. So each year, 4,000 veterinarians, leading to right now, there's roughly 96 to 100,000 veterinarians practicing in the United States. So we're a small but mighty profession. So as any medical professional, we have to learn daily because things change daily. Science evolves, new medicines, new techniques come out. So it's incumbent upon us to, on a daily basis, to learn these new items to advance care. So as a veterinarian, we're required by law to have a certain number of hours of continuing education, but that's really at the minimum. Really, for us to be on top of what we're doing and to be able to treat our patients effectively, we have to be reading, going to seminars, going to workshops, training workshops to be able to learn those things, and that's what we do. So it's on a daily basis we're learning something. And I think that's one of the other exciting parts about our profession, is that it's ever changing. And we can really, one day to the next, there's a whole new discovery of a drug that we can use that helps our patients. So it makes it really exciting. RH, in my mind, is a great incubator for healthcare providers, veterinarians, folks like us that do this. I say it all the time that when I see young people that come through the admissions process or applying to veterinary school and they have a strong 4-H background, I'm always very excited because I know these are the young people that worked hard, have good leadership skills, good time management skills, they have some creativity, and they certainly have drive and passion for what they are working on. That's what I saw and I learned from my 4-H years, and certainly I see it in those that come today. So I think 4-H is a great incubator for these kind of essential skill sets that young professionals need. And we see that in our application process, and we see that applied to students when they come to veterinary school. So the craziest animal I've worked with would be an animal back when I was a student. It was a Texas Longhorn. The cow's name was Weisman, and Weisman was a Texas Longhorn, belonged to a rodeo clown that traveled on the professional circuit. Weisie's span of horn, so if you think about how wide, when you take the horns all the way out, was something in the neighborhood, I don't remember exactly, but was something in the neighborhood of almost 13 feet from side to side. So every time we took Weisie from a certain place to another, we would have to do things to maneuver her head so we could get her to one place to another, because she was wider than some of the entry and exit ways. Weisie had an abdominal infection that she fought called peritonitis. She was my patient for about 6 weeks. Happy to say we made her better, and Weisie continued out on the professional rodeo tour, but with her clown handler, but Weisie, the Texas Longhorn. When I was age 5, I always thought medicine would be something I do. So medicine, or I wanted to be a conductor of like orchestra or band. I think the most important thing that young people can do that are interested in veterinary medicine is to be engaged in the profession. So talk to your local veterinarian, ask if you can shadow, ride along, those kind of things, and see what we do on a day-to-day basis. That's number one. Number two is do well in school. Veterinary medicine, along with all health professional programs, is a very challenging and rigorous degree program. So you have to do well in school. And that way it sets you up for success getting your degree. And lastly, I would search out opportunities such in 4-H with the veterinary science program, coming to some of the trips and things that are available through 4-H. Also, some of the universities like Purdue, we have the Boiler Vet Camp. Search out these opportunities so that you can come and see exactly what it's like to be a veterinarian. You put all that together, and I think that really sets you up well for pursuing your career.